So hello, good evening to all of you. Okay, so good evening to all of you. All okay? I'm audible? Am I audible? And visible I am. So we come to the ultra rapid revision for FMGE. Okay, today's topic I'll discuss is the face. Another very important topic for you. Mandibular nerve we'll discuss later, but today we'll discuss the face, we'll discuss the venous drainage of the face, and we'll discuss the nerve supply of the face. That is an extremely important topic for you. Okay, so are you all ready? Answer, let it be an interactive session. Okay, so I'll start. Okay, as you all know, I'm Dr. Pradeep Pawar, Professor of Anatomy. I've been teaching anatomy for the last 21 years. Okay, I'll start with this white screen so it will be easy for you to understand. Okay. Now, starting with the venous drainage of the face. Have a look. Venous drainage of the face. Understand this. All topics are very important. Okay, I'll start it like this. Tell me now, what is this for the mandible? This. And what is this for the mandible? This is the body of the mandible. And what is this known as? Angle of the mandible. This is the ramus of the mandible, and this junction is known as the angle of the mandible. Angle. Okay. So this is the body of the mandible. That's the ramus, and this junction is the angle of the mandible. I'm starting with venous drainage of the face. Understand this venous drainage, understand the dangerous area of the face and how infections from the dangerous area go to the cavernous sinus. Okay, starting with the venous drainage of the face. Have a look, understand this. Now, there's a vein above the orbit. What do you call this vein as? The vein above the orbit, and this is what we call as the supraorbital vein. Supraorbital vein. And this is the frontal bone. Frontal bone. There's a small pulley here. Pulley. What do you call the pulley as? Trochlea. Trochlea. And this vein is therefore known as the supratrochlear vein. Supratrochlear vein. So supraorbital and supratrochlear joins to form a vein here at the medial angle of the eye. And this is what we call as the angular vein. Angular vein. So supraorbital, supratrochlear vein joins to form at the medial angle of the eye. It's at the angle of the eye. It is therefore known as the angular vein. Angular vein. This angular vein now continues down as the same one. Same angular vein now continues down as this is what we call as the facial vein. Facial vein. Okay, so this now becomes the facial vein. Tell me, what is this region here? This region. That's the temporal region. And there's a vein coming from here. What do you call this vein as? This is the superficial temporal vein. Superficial temporal. And there's a vein coming from the maxilla. We call this as the maxillary vein. Maxillary. So superficial temporal and maxillary now joins to form a vein here. And this is formed behind the mandible. It's behind the mandible. What do we call this as? The retromandibular vein. Retromandibular vein. Just give me a reference. Have you come across this retromandibular vein somewhere? Retromandibular vein. It is formed by the joining of superficial temporal and maxillary. This is the retromandibular vein. And have you come across this retromandibular vein somewhere? Answer this. Just give a reference. Retromandibular vein. Yes, answer. Retromandibular vein. Where is it found? Where do you get this retromandibular vein? Behind the ramus of the mandible. That's fine. I want something else. Answer. Yes, very good, very good, very good. It's the content of the parotid gland. Yes, Samukta, that's the content of parotid gland. You remember the contents of parotid gland from superficial to deep? The most superficial is the facial nerve, the second is the retromandibular vein, and the third one is the external carotid artery. External carotid artery. So this is the same retromandibular vein which has come here. Now this retromandibular vein divides into two divisions. I'm just making this bold so it will be seen here. It divides into an anterior and posterior divisions. Okay, so retromandibular vein in the parotid gland divides into an anterior and posterior divisions. The anterior division joins with this vein. What is this vein now? That's the facial vein and forms the common facial vein. This becomes a common facial vein, and this common facial vein drains into internal jugular vein. Internal jugular. Clear? So anterior division of retromandibular joins with the facial to form the common facial vein, and this common facial vein drains into internal jugular vein. Internal jugular. Now this is the posterior division of retromandibular, and there's a vein coming from behind the ear. There's a vein coming from behind the ear. What do you call this as? Yes. What is this vein coming from behind the ear known as? The posterior auricular vein. Posterior auricular vein, and the posterior auricular vein joins with the posterior division of retromandibular vein, and this vein which is formed here is known as the external jugular vein, and this external jugular vein drains into the subclavian vein. Subclavian vein. So the external jugular vein drains into the subclavian vein. So that's about the venous drainage of the face. Venous drainage of the face. Are you all following this? I'll draw the slide once again with the highlighter so it will be clear for you to understand. Okay, just have a look at this. I'll draw the same with the highlighter and I'll label this for you. Okay. Just one moment. Right, I'll start. Just have a look and understand this. I'll draw the same slide for you once again. So try to identify the veins that I'm drawing. That's the ramus of that's the body of the mandible. That's the ramus of the mandible. That's the ear here. I've drawn this as the eye and the orbit. Okay, I'll start with the veins now. Answer now. This vein above the orbit, that's the supraorbital, and this is the supratrochlear vein. The supraorbital and supratrochlear joins to form the angular vein. The same angular vein continues as the facial vein. That's the superficial temporal, that's the maxillary. Together joins to form the retromandibular, divides into an anterior and posterior divisions. Anterior division of retromandibular joins with the facial to form the common facial vein, and this common facial vein drains into the internal jugular vein. The posterior division of retromandibular joins with a vein coming from behind the ear. What's that? That's the external jugular vein, and this external jugular vein drains into the subclavian vein. Is this clear to all of you? Are you all following this? Right? So this is about the venous drainage of the face. Venous drainage of the face. You can label this if you want. You can label this. This I'll just put numbers here. This one is the supraorbital. Two is the supratrochlear. Supratrochlear. 3 is the angular vein. Angular. 4 is the facial vein. Facial. 5 is the superficial temporal. Superficial temporal. 6 is the maxillary vein. Maxillary. Okay. Coming here. 7. The retromandibular vein. Retromandibular vein, and retromandibular vein divides into an anterior and a posterior division. This is anterior and this is the posterior division. So anterior division of retromandibular joins with facial to form, I'll write this as the common facial vein. Okay, common facial vein. And this common facial vein drains into what? The internal jugular vein. Okay, I'll put 9 as the posterior auricular vein. So posterior auricular vein joins with the posterior division of retromandibular vein, and the vein which is formed is the external jugular vein. External jugular vein, and this external jugular vein drains into subclavian vein. This is clear to all of you? Yes. This is the venous drainage of the face, and this is extremely important because now you tell me which part of the face is known as the dangerous area of the face. Dangerous area of the face. Which part of the face is known as the dangerous area of the face? Yes, very good. The lower part of the nose and the upper lip. This part of the face, the lower part of the nose and the upper lip. This part of the face is known as the dangerous area of the face because any infection from this area directly goes to the cavernous sinus. Cavernous sinus. Now, how does the infection go? We'll see that. Okay, just see the slide once. Just see the actual slide once. So it will become very easy for you. The lower part of the nose and the upper lip. This is known as the dangerous area of the face. Okay, I'll get back. I'll clear this. Just have a look at this. This is about the venous drainage of the face. Okay, have a look. I'll just highlight this for you. Now, we'll start. Tell me now, what is this vein? Chalo, be quick and answer. What is this vein? So this will be visuals also for you. This should be clear. The same thing which you have just drawn. This is the answer, all of you. Be interactive. It will be easy for you then. So what is this vein? About the orbit supraorbital, right? And what is this vein here? This is the supratrochlear vein. So supraorbital, supratrochlear joins to form. What is this vein now? Angular vein. The angular vein now continues as, what is this now? Yes, very good. What is this now? This is the facial vein. That's the facial vein, right? Very nice, very nice. What is this region here? What is this region? That's the temporal region. Identify this muscle here. If you can identify this muscle, what is this muscle here? This muscle which begins from the temporal fossa. This is the temporalis. Yes. And this vein coming from here, this is the superficial temporal vein. Superficial temporal vein. The maxillary joins to form here. That's the retromandibular vein. Retromandibular vein divides into an anterior and posterior divisions. Anterior and posterior divisions. Supratrochlear. Okay. Anterior division of retromandibular joins with facial here. Facial. And this is the common facial vein. And this common facial vein drains into internal jugular vein. Internal jugular vein. Okay. This is the posterior division of retromandibular vein. This is the posterior auricular vein. I'm so sorry. That's the posterior auricular vein joins with the posterior division of retromandibular vein, and the vein which is cut here is external jugular vein, and this external jugular vein would drain into the subclavian vein. Clear? So this slide is very clear to all of you. That's about the venous range of the face. Visual slide also. Just tell me one thing. What is this for the mandible? This part. What is this part of the mandible? This is the body of the mandible. Body, right? That's the body. And what was here? What is here that we have cut? What have we cut here? That's the ramus of the mandible. That's the ramus. Okay. So this is the body. What have we cut here? We have cut the ramus of the mandible, right? What is this fossa again? That's the temporal fossa. Now we remove the ramus. We remove the ramus of the mandible and we are right into, answer, what is this area lying deep to the ramus of the mandible? If you can answer this. That's the temporal fossa. We remove the ramus and deep to the ramus is, guess this fast. I'm waiting. Yes, what is this? Pterygopalatine. No, it's not pterygopalatine. Samyukta, it's not pterygopalatine. It's infratemporal. Very good, Vanraj. Yes, it's infratemporal fossa. Hare Krishna. So that's the temporal fossa. We remove the ramus and that's the infratemporal fossa. And in this infratemporal fossa, we get two muscles of mastication. Which are those? Answer this. Two muscles of mastication. Right inside the infratemporal fossa. Answer this. You can guess. Even if it is wrong, it's okay. So what are the muscles of, two muscles of mastication we get here? See, there are total 4 muscles of mastication. Yes. So this is the medial and the lateral pterygoids. They lie in the infratemporal fossa. The muscle which begins from the temporal fossa, that's the temporalis. The muscle attached to the angle of the mandible outside, what's that? Masseter. So they are outside. Who's left now? Yes, the medial and the lateral pterygoids. And where do this medial and the lateral pterygoids lie? They lie in the infratemporal fossa. Is this clear to all of you? And where is the infratemporal fossa lying? It lies deep to the ramus of the mandible, right? But you know, we can't see the pterygoids. Even though you remove the ramus, we are not able to see the pterygoids because these pterygoids are surrounded by a plexus of veins. These pterygoids are surrounded by a plexus of veins, and this is what we call as the pterygoid venous plexus. Pterygoid venous plexus. Have a look at this slide. Look, this is the pterygoid venous plexus. Are you all following this? And this pterygoid venous plexus lies over the pterygoids. And you know, when this pterygoids contract, all the veins are drained out of the blood. This is exactly similar to a muscle of the lower limb. What is the muscle of the lower limb which has got large number of venous sinuses there? Yes? Yes. Where are we? What is the muscle of the lower limb which has got large number of venous sinuses? Shelby, you remember? Yes, and that is the soleus muscle. Yes. So the muscle of the lower limb where we have got large number of venous sinuses, that's the soleus. And when this soleus contracts, all the veins are drained out of the blood. Soleus is therefore known as what? The peripheral heart. Peripheral heart. The second peripheral heart in the body are the pterygoids. Pterygoids are also known as peripheral hearts. Why? Because these pterygoids are surrounded by the pterygoid venous plexus. Are you all following this? The pterygoids are surrounded by the pterygoid venous plexus, and when these pterygoids contract, all the veins are drained out of that blood. Okay, fine. So, but now we have to Shibra. Okay, so now these pterygoids are surrounded by the pterygoid venous plexus, and when these pterygoids contract, all the veins are drained out of the blood. Pterygoids are therefore known as the peripheral heart. Okay, clear to all of you? So peripheral heart, one is the soleus, the second one are the pterygoids. Is this clear to all of you? Now understand, yes, now understand how does the infection go to the cavernous sinus? Now which part of the face is the dangerous area of face, and how does the infection from here go to the cavernous sinus? Okay, that's fine. Just have a look, understand this now. I'll just once again draw the slide for you. Revise this. The more you revise, the more the concepts are going to be clear to you. I'll once again draw the slide. I'll draw the dangerous area of the face for you once again. Chalo, I'll start. Have a look. Answer this now. Be fast. This is the supraorbital. That's the supratrochlear. That's the angular. Angular becomes facial. That's the superficial temporal. That's the maxillary. Retromandibular. Anterior posterior divisions. Anterior division joining with facial to form the common facial drains into internal jugular vein. The posterior division joins with the posterior auricular, forms the external jugular, and this drains into the subclavian vein. Excellent. Very good to all of you. Now tell me this part of the face, the lower part of the nose and the upper lip, and this is what we call as the dangerous area of the face. And why is this area known as dangerous area? Because infection from here directly goes to a sinus here. This is inside the skull, and this is what I draw as the cavernous sinus. Now see, how does the infection from the dangerous area go to the cavernous sinus? Just have a look, understand this. Okay, I'll start. Now see this. How does the infection go? Right, from the dangerous area, concentrate and answer. From this dangerous area, infection first goes to this vein. What is this vein? What is this vein? Don't sit and talk, just answer. What is this vein? From the dangerous area, the infection first goes to this facial vein. From the facial vein, there's a vein, the infection goes like this in the reverse way. What is this vein? This is the angular vein. And from the angular vein, there's a vein which directly goes to the cavernous sinus. What do you call this vein? As the superior ophthalmic vein. So from the dangerous area, facial vein, angular vein, the superior ophthalmic vein, and the cavernous sinus. Okay, so what is the superior ophthalmic vein for the cavernous sinus? The superior ophthalmic vein is coming towards the cavernous sinus. It is bringing blood towards the cavernous sinus, and such veins which brings the blood towards the cavernous sinus are said to be tributaries of cavernous sinus. Tributaries of cavernous sinus. Okay, so one tributary of cavernous sinus is going to be the superior ophthalmic vein. Is this clear to all of you? So dangerous area of the face, the facial vein, angular vein, superior ophthalmic vein, and cavernous sinus. Very good. So that's one way of spread of infection. Now there's one more way of spread of infection. Look, I draw this as the pterygoid venous plexus. Okay, I draw this as the pterygoid venous plexus. This pterygoid venous plexus overlies the pterygoid muscles, okay, in the infratemporal fossa. And how does the infection go? Have a look, understand this. From the dangerous area, infection first comes to this vein again. What is this now? Facial vein. From the facial vein, there's a vein here. What do you call this as? Deep facial vein. Deep facial vein to the pterygoid venous plexus, and from the pterygoid venous plexus there's a vein which goes to the cavernous sinus. Now what are these veins? These are the veins which connects the veins outside the skull with the veins inside the skull. What are they known as? Answer this. They connect the vein outside the skull with the veins inside the skull. Yes, what do you call such veins as? Excellent. This is known as the emissary vein. Very good, very good. So these are known as the emissary vein. So clear to all of you, how does the infection from the dangerous area? See the second pathway, from the dangerous area to the facial vein, then the deep facial vein, pterygoid venous plexus, emissary vein, and the cavernous sinus. Is this clear to all of you? Crystal clear? Yes. So I'll just make this flowchart for you. It will be easy to understand. Okay. I'll make this flowchart for you. Just have a look. Starting with dangerous area of the face. I'll write it here. Dangerous area of the face. Yes, very good. Dangerous area of the face. This is a very important flowchart. The infection first comes to the facial vein. Facial vein. Now there are two ways of spread of infection. One, start on one side, that is angular vein. Angular vein, then is the superior ophthalmic vein, superior ophthalmic vein, and the cavernous sinus. Cavernous sinus, okay. Angular vein, superior ophthalmic vein, and the cavernous sinus. Now go to the other side. From the dangerous area of face to the facial vein, now we come to the deep facial vein. Deep facial vein, then pterygoid venous plexus, pterygoid venous plexus, emissary vein, and the cavernous sinus. Emissary vein and the cavernous sinus. Is this clear to all of you? So dangerous area of face, facial vein to the deep facial vein to the pterygoid venous plexus, emissary vein, and the cavernous sinus. Yes, is this all? Is this clear to all of you? So that's about the venous drainage of the face, that's about the dangerous area of the face, and this is how the infection from the dangerous area goes to the cavernous sinus. Okay, something else I'll tell you. So this is about the venous drainage. We start with the sensory nerve supply of the face. Sensory nerve supply. Just quickly tell me, what is the motor nerve supply of the face? Motor nerve supply? Answer this. What is the motor nerve supply of the face? You answer. I'll ask you questions. Whatever you know, you can answer. The motor nerve supply of the face is... Answer. I'm waiting for your answer. The motor nerve supply of the face is by the... Motor nerve supply of the face is by the facial nerve. Facial nerve. The facial nerve, how does it get outside the skull? If you can just tell me. Just be quick and answer. How does the facial nerve get out of the skull? Which is that foramen through which the facial nerve gets out of the skull? I'll just tell this motor nerve supply first. Yes, facial nerve, right? Which foramen does the facial nerve get out of the skull? Excellent. Stylomastoid foramen. And which is that foramen through which the facial nerve enters? Into which foramen does the facial nerve enter inside the skull? Inside the skull. Into which foramen does the facial nerve enter inside the skull? Very excellent, excellent, Hare Krishna. Yes, that is the internal acoustic meatus. So the facial nerve enters the internal acoustic meatus. It goes in the middle here, and then it gets out through the stylomastoid foramen. Excellent. And the moment it gets out through the stylomastoid foramen, where is it lying now? It's right inside the parotid gland. Okay. So the facial nerve gets out through the stylomastoid foramen, lies inside the parotid gland. It is the most superficial structure within the parotid gland. Who's deep to the facial nerve? Who's deep to the facial nerve? The retromandibular vein. And who's still deeper to it? External carotid artery. External carotid artery. So once again, I'm telling you the contents of the parotid gland. The most superficial facial nerve, then is the retromandibular vein, and the third one is the external carotid artery. And in this parotid, the facial nerve now gives 5 branches to supply the muscles of facial expressions, right? Which are the 5 branches of facial nerve? The first one, yes, the first one, answer, temporal, very good. The second, excellent, zygomatic, very good. The third one, buccal, right? Very nice, buccal. The fourth runs along the margins of the mandible, and this is what we call as marginal mandibular. Yes, you got it right, marginal mandibular. And the last one goes in the neck, and this is what we call as the cervical branch of facial nerve. Cervical branch of facial nerve. Excellent. So these are the 5 branches of facial nerve: temporal, zygomatic, buccal, the marginal mandibular, and the cervical branch of the facial nerve. And this this motor fibers of facial nerve, you understanding? This motor fibers of facial nerve come from which nucleus, which is in the brainstem? Tell me, which is that nucleus of facial nerve which is going to supply the muscles of facial expressions, or which is going to supply the muscles of second pharyngeal arch? Facial nerve is a nerve of second pharyngeal arch. And what is the name of the nucleus of the facial nerve inside the brainstem? To be very specific, inside the pons, which is going to supply the muscles of facial expression. I'm just adding to it. Okay, I'm just adding to what I'm telling you. If you can answer this, yes, excellent, Shruti. Yes, excellent. And this is what we call as the motor nucleus of facial nerve. The motor nucleus of facial nerve. Very good. And it is not GSE. No, Mona, it's not GSE. It is the motor nucleus of facial nerve. It's not nucleus of tractus solitarius. That's for the tongue, no tongue. What is the name of the nucleus which is going to supply the muscles for the facial nerve? That's the motor nucleus of facial nerve. And this motor nucleus of facial nerve, the fibers of the motor nucleus winds around what? If you can answer this. So I'm just trying to correlate things for you. That's okay, Mona. That's okay. You make mistakes, you will be able to improve then. That fibers which begins from the motor nucleus, they wind around something. They wind around something. Just try to correlate. It is very nice. It's very interesting. They wind around the abducens nucleus. That's so nice. Excellent. So the fibers of facial nerve, they wind around the abducens nucleus and they form an elevation in the floor of the fourth ventricle. And this is what we call as the, yes, if you can answer this. Yes. The fibers of facial nerve, they wind around the abducens nucleus and they form an elevation in the floor of the fourth ventricle, and this is what we call as, answer, you're close to it. It is called as what? Samyukta. It's not superior colliculus. Yes, Hare Krishna, but still specific. What is that known as? You should know this. You should know this. This is known as the facial colliculus. Facial colliculus. You remember facial colliculus, where do you get? In the floor of the fourth ventricle. This we know. And this facial colliculus is formed by the fibers of facial nerve as they turn around the abducens nucleus. And that fibers of facial nerve arise from the motor nucleus of facial nerve. Can you correlate this? Are you able to understand and correlate things? So what I want you to understand is the fibers in this facial nerve, the fibers, that's okay. the fibers of the facial nerve which are going to supply the muscles of facial expression, or the fibers of facial nerve which are going to supply the muscles of the second pharyngeal arch, are derived from which nucleus of the facial nerve? That's the motor nucleus of facial nerve. Motor nucleus of facial nerve, and this motor nucleus is lying in the pons, and this motor nucleus forms. I'll just make this for you. If look, see, this is the motor nucleus of facial nerve. Just one moment. This is the motor nucleus of facial nerve, and this is the nucleus of abducens nerve. And what are the fibers of facial nerve doing? What are the fibers of facial nerve doing? Look, the fibers of facial nerve, they turn around the abducens nucleus and they come out like this. No, they wind around and they get out. And as they wind around, they form an elevation here in the floor of the fourth ventricle, and this is what we call as the facial colliculus. That's the facial colliculus. Just try to correlate this. I just came to the facial nerve, so I've just added something for you. That's fine. That's fine. And tell me, if the facial nerve is damaged at the stylomastoid foramen, what do we get? If the facial nerve gets damaged at the stylomastoid foramen, or it is injured at the stylomastoid foramen, what will the person complain of? If you can answer this, what will the person complain of? If the facial nerve is damaged at the stylomastoid foramen, what will the facial nerve? Bell's palsy. Excellent, excellent. That is the Bell's palsy. Very good. If it is injured at the stylomastoid foramen, it's a lower motor neuron type of lesion, and this is what we call as the Bell's palsy. And half of the face, the entire half of the face is paralyzed. Very good. The entire half of the face is paralyzed. So that is Bell's palsy. Very good. So you've understood this. Excellent. Lower motor neuron type of paralysis. Yes, right. So now that's about the motor nerve supply of the face. I'm telling you the sensory nerve supply of the face. Another extremely important topic for you for the MCQs. Okay, sensory nerve supply. Have a look. I'll once again draw the face for you. Starting with the sensory nerve supply of the face. That's again the body of the mandible. That's the ramus of the mandible. That's the external acoustic meatus. That's the eye here. Now, starting with sensory nerve supply of the face. Yes, very good, Mona. The entire face sensory supply is by whom? The entire face sensory supply is by the trigeminal nerve. Trigeminal nerve. And there are three branches of trigeminal nerve which is going to supply sensory supply to the face. This much part is supplied by what? The ophthalmic division of trigeminal nerve. This part is supplied by what? The maxillary division of trigeminal nerve. And this area is supplied by the mandibular division of trigeminal nerve. That means the entire face is supplied by the trigeminal nerve through its three divisions: ophthalmic, maxillary, mandibular, except, if you can answer this, except, what have I drawn here? Except, answer. This you should know, and this is extremely important for you. Except, which area of the face is not supplied? I'm asking. Which area? The skin over the angle of mandible. That's so nice. So skin over the angle of mandible, and this is supplied by the greater auricular nerve. The greater auricular nerve. Right? So skin over the angle of mandible is supplied by the greater auricular nerve, and this greater auricular nerve is a branch of a plexus found in the neck, the cervical plexus. Cervical plexus. Okay, we'll come to this. Very good, all of you. You're answering very well. So the entire face sensory supply is by the trigeminal nerve through its three divisions: ophthalmic, maxillary, mandibular, except a small area over the angle of the mandible supplied by the greater auricular nerve, which is a branch of cervical plexus. Okay, now C2, C3. Okay, now coming to this, what are the branches? See, ophthalmic, maxillary and mandibular, they themselves do not supply. They give branches, and these branches are going to supply the face. Starting with the ophthalmic division of the trigeminal nerve. If you can answer this, what are the branches of it? The same. This is the same nerve above the orbit, the same as that of the veins. The names are the same. Supraorbital. and this is the supratrochlear nerve. Now, nerves, these are the branches of ophthalmic division of trigeminal nerve. Supraorbital, supratrochlear. Now, this is right below this. Look, this is right below this. What was this? This was supratrochlear. So what do you call this as? This is what we call as the infratrochlear nerve. Infratrochlear nerve. This is a very important MCQ. The nerve supplying the tip of the nose. Answer this. Nasociliary, external nasal. External nasal is a continuation of nasociliary. Yes, that's external nasal. And you know, there's a gland here. There's a gland on this side. What is this gland here? The lacrimal gland. And the nerve here is known as the lacrimal nerve. Lacrimal nerve. So what are the branches of ophthalmic division of trigeminal nerve? The supraorbital. I'll write this for you. Supraorbital, supratrochlear, infratrochlear, external nasal, and the lacrimal nerve. Lacrimal. So these are the branches of ophthalmic division. Now coming to the maxillary division of trigeminal. Maxillary division of trigeminal. See, that's the orbit here. That's the orbit, and there's a foramen right below the orbit. Right below the orbit. Name the infraorbital foramen. Infraorbital foramen, and there's a nerve which comes out from here, and this is what we call as the infraorbital nerve. Infraorbital nerve. Okay, infraorbital. Now there's a nerve which supplies the skin over the zygomatic area and the face, and this is what we call as the zygomaticofacial. Zygomaticofacial. And there's a nerve which supplies the skin over the zygomatic and the temporal regions, and this is what we call as the zygomaticotemporal nerve. Zygomaticotemporal, right? So what are the branches of maxillary division of trigeminal nerve? That's the infraorbital, zygomaticofacial, and zygomaticotemporal, right? Now coming to the last nerve, and that's the mandibular division of trigeminal nerve. What are the branches of the mandibular division of trigeminal nerve? This is very important. This you have to know. Tell me, what is this foramen here, right in front of the chin? What is this foramen here? Answer this. Right here, on the chin. What is that foramen? I'm looking at the screen for your answer. What is the foramen here, just in front of the chin? That's the mental foramen. Excellent. And the nerve coming out from here is therefore known as the mental nerve. That's nice, mental nerve. There's a nerve which supplies the skin over the auricle and the temporal regions. If you can answer this. There's a nerve which supplies the skin over the auricle and the temporal regions. And this is what we call as the auriculotemporal nerve. Auriculotemporal nerve. And there's a nerve here. And this nerve is going to supply the skin over the buccinator. If you can tell me what nerve is this? It supplies the skin over the buccinator. This muscle is the buccinator, and the skin over the buccinator is supplied by this nerve. If you can tell me what is this nerve? This is the, yes, I'm waiting for your answer. This is the answer. This is the buccal branch of mandibular nerve. That is also known as buccal nerve. Buccal nerve. Buccal nerve. No, it's not inferior alveolar. It's buccal nerve. Okay, so this is mental nerve. This is auriculotemporal nerve, and this is the buccal nerve. But this is the buccal branch of mandibular nerve. Is there a buccal branch of someone else also? Is there a buccal branch of someone else? Some other nerve also has got a buccal branch. That's the buccal branch of facial nerve. There's a buccal branch of facial nerve, and there's a buccal branch of mandibular nerve also. Now what's the difference in them? What's the difference? The buccal branch of facial nerve is motor, and the buccal branch of mandibular nerve is sensory. Okay, and this buccal branch of mandibular nerve is going to pierce a muscle. Tell me, this is an MCQ. The buccal branch of mandibular nerve is going to pierce a muscle and come out. It has to come out, not to supply the skin. So it has to pierce a muscle. If you can tell me, what muscle is it? What muscle does it pierce? The buccal branch of mandibular nerve pierces a muscle and comes out to supply the skin over the buccinator. Answer? What muscle is that? It pierces the buccinator. Very good. It pierces the buccinator muscle. Buccinator. So who pierces the buccinator? One is the buccal branch of mandibular nerve, and there's one more nerve which pierces the buccinator. What is that? There's one more structure which pierces the buccinator. If you can answer this for me. One is the buccal branch of mandibular nerve. The second one, structure piercing the buccinator. Another very important MCQ for you. Yes, I'm waiting for your answer. Structures piercing the buccinator. One is the buccal branch of mandibular nerve. The second one, excellent, very good. That is the parotid duct. Yes, very nice. All of you have answered. That is the parotid duct. Parotid duct. Okay, so see, there are many sub-questions within the topic which can be asked as MCQs for you. Right? I just started with what? Buccal nerve. I told you buccal nerve is going to pierce what? Buccinator. What is the buccal nerve supply? The skin over the buccinator. Who else pierces the buccinator? Parotid duct. Okay, and there's a buccal branch of facial also, but the buccal branch of facial nerve is motor and the buccal branch of mandibular nerve is sensory. Okay, I'll just label this for you. I'll put this number 1. I'll label this for you. Okay, very good. 1, this is very nice. This is the supraorbital. Second, supra, this you should know, supratrochlear. 3 is infratrochlear. 4, external nasal. And 5 is lacrimal. Okay, coming to the 6th, infraorbital. 7 and 8. This is easy. 7 and 8, zygomaticofacial. Zygomaticotemporal. Zygomaticotemporal. This is 9, 10, 11. I'll just write this for you. 9 is mental, 10 is buccal, 11 is auriculotemporal. And what's this 12? 12 is greater auricular nerve. And this greater auricular nerve is a branch of cervical plexus. The greater auricular nerve. That's a branch of cervical plexus. Just look at the slide. See the slide. This is another visuals for you. So be clear about this. Are you all clear? Crystal clear about this? So I've told you the sensory nerve supply. I've told you the motor nerve supply of the face. I've told you the venous drainage of the face, the dangerous area of the face, and how does the infection go to the cavernous sinus. Just have a look at this slide. I'll clear this. Okay, see this slide. Right, this is so nice. Just have a look at this slide and quickly try to identify this. Chalo, start. What is this nerve? It's a rapid fire round. Be quick, fast, and answer. What is this nerve? Supraorbital. That's supraorbital. What's that? Supratrochlear. That's infratrochlear. That's external nasal. And that's lacrimal. Okay, very nice. Lacrimal. This is infraorbital. This is zygomaticofacial and this is the zygomaticotemporal. Okay, infraorbital, zygomaticofacial, zygomaticotemporal. This is mental. This is buccal. And what is this muscle it is piercing? That's the buccinator muscle. And this is the auriculotemporal. Okay, so mental, buccal, auriculotemporal. And what is this nerve? It supplies the skin over the angle. This is the greater auricular nerve. And this greater auricular nerve is a branch of the cervical plexus. Okay, it's a branch of cervical plexus. Is this clear to all of you? Okay, answer this MCQ. So same thing I've just put in the form of an MCQ. So skin over the angle of mandible is supplied by greater auricular nerve. Greater auricular nerve. Yes. Answer is B for this. Okay, so that's about the lecture. That's about the lecture. You're all understanding this. I hope everything is clear. So now we've got this plus subscriptions. Okay, we've got daily live classes, structured courses. We've got live tests and quizzes and unlimited access. An iconic subscription where you get the best of Unacademy and the best of pre-platter for you. A limited time offer. So the prices are further slashed. Just have a look at the website. 3+1. Now the exams have been postponed. So 3 months you get 1 month extra free for that. Now this is the best part. We are starting with the first professionals here, the first year professionals from 12th of this month. We are starting with the first year professional batches. This is for season 1. We're beginning from 12th of May 2021 and FMG test and analysis batch. This is the target 2022. We're starting from 12th of May, May to November. Evening batches. We have got 34,000 curated MCQs for you, and you can download the app for the iconic subscription. I hope everything is clear to you. Yes? Any doubts? Inferior alveolar nerve, Shivanjan. Inferior alveolar nerve is a branch of mandibular nerve, and this inferior alveolar nerve enters into the mandibular foramen. It enters into the mandibular foramen. It supplies the lower jaw and the lower teeth. And the same inferior alveolar nerve emerges out of the mental foramen. It is now known as the mental nerve. Mental nerve. You understanding? That means the inferior alveolar nerve will go inside the mandibular foramen. And where is the mandibular foramen? That's the ramus of the mandible. On the inner aspect, on the medial aspect of the ramus, there's a mandibular foramen. And what enters into that? The inferior alveolar nerve and vessels. And the inferior alveolar nerve supplies the lower jaw, the lower teeth, and the same comes out as mental nerve. Is this clear, Shivanjan? Anything else? Any other doubts? Yes, it was very nice teaching you. I enjoyed teaching you. It was a very interactive session. And I hope everything is clear. If you have any doubts, you can send a mail, right? If you have anything else, any other doubts, you can just tell me. So this should be very clear. Plenty of MCQs on this topic. Also visuals. Yes, Shivanjan, got it, no? Yes. And if you can just tell me, before the inferior alveolar nerve enters the mandibular foramen, it gives a branch. Open for all. Answer this. Before the inferior alveolar nerve enters the mandibular foramen and then comes out as mental nerve, before it enters the mandibular foramen, it gives a branch. Name of the branch. Yes, the question is open to all of you. What is the name of the branch? Wait, Yamini, what is the name of that branch? Tell me. What is the name of that branch? That is the nerve to mylohyoid. Nerve to mylohyoid. And the nerve to mylohyoid supplies the mylohyoid and the anterior belly of digastric. Okay, so the inferior alveolar, not lingual, my child. It's not lingual. Vanraj, no, it is the nerve to mylohyoid. Okay, so inferior alveolar nerve, before it enters the mandibular foramen, it gives the nerve to mylohyoid, and this nerve to mylohyoid it is. That's okay. Even if you make a mistake, that's okay. Don't worry. So the concepts are clear, no, to all of you? Concepts are clear. Okay, I'll stop here. Fine, thanks a lot. Thank you to all of you. Thank you to all of you.